Pharmacodynamics. So we have a drug and we have a receptor. When they bind, this equals a response. Biological systems can only produce a finite response. Drugs are also known as ligand, since they bind to the receptor. Intrinsic activity. Also, you can see it as alpha. This is a property of the ligand, or in other words, the drug. If you are a full agonist, your intrinsic activity, or alpha, is equal to 1. What does this mean? We can produce the maximum amount of response that the system is capable of producing. Side note, when comparing different drugs' intrinsic activity, it's assuming full saturation of receptors. What exactly does this mean? Say you have the cell, and the receptors are as you can see, the receptors are the ones in red. The dark blue is the ligand, or drug. As you can see here, if the cell only has 6 receptors, all 6 receptors are occupied. This is what we mean by saturation of the receptors. If it produces the maximum amount that system is biologically capable of, it has an intrinsic activity of 1. If that same drug, assuming 100% saturation of the receptors, produces anything less than what the system is biologically capable of, that intrinsic activity is less than 1. So when we're comparing two drugs, drug A, drug B, we can see that drug A is a full agonist. Why? Because it provokes 100% of the biological capacity to respond. So we're getting the maximum amount of response that we could possibly get. Drug B has an intrinsic activity less than 1, so this tells us that it is a partial agonist. This is less than 100% of the biological maximum capability. Let's do an example. Say we have this muscle. Its maximum contraction is 40 centimeters. If we were to put it in a solution of drug A and we dunk it in there so that all the receptors on the cells of that tissue are saturated with drug A full agonist, we can expect that muscle to contract 40 centimeters. Why? Because that is the maximum contraction that muscle is physically able to produce. And its intrinsic activity is 1 or 100%. If we have the muscle completely dunked in a vat of drug B, such that all the receptors in that piece of tissue, all the receptors on the cells that are within that tissue are saturated with drug B, and the muscle contracts 30 centimeters, by definition, this is a partial agonist. This drug's intrinsic activity equals 0.75 or 75%. Another kind of ligand is antagonists. They sit at the receptor binding site so that other ligand can't bind. So here you can see how the antagonist is blocking the receptor from the ligand. Most commonly, some sort of agonist. These guys want to bind, but they can't. Antagonists have an intrinsic activity that is equal to 0. This means they produce no response. An example I like to think of to put all this stuff in perspective is morphine. Morphine is an opioid. Opioids are usually abused because of the state of euphoria that they induce. Let's just focus on morphine's euphoria response for the sake of illustration. So morphine produces euphoria. It's really good at doing this. It is actually a full agonist, meaning it produces 100% euphoria. Patients may be addicted to opioids like morphine. Taking too much causes respiratory depression in the central nervous system. This is a big emergency, as eventually you'll stop breathing completely and then die. What can we do? We can block off the mu opioid receptors with a powerful antagonist like Narcan. Narcan has a 10 to 50 times higher affinity for the mu receptor than morphine. Morphine, or the opioid, cannot bind. To help opioid-dependent patients with withdrawal symptoms, we give buprenorphine, a partial agonist of the mu receptor. Morphine's intrinsic activity is much less than morphine's intrinsic activity, but it's high enough to help. It activates mu receptors enough to prevent withdrawal symptoms. It actually produces limited opioid effects, but not a strong high. Buprenorphine also has a very high affinity, a much higher affinity to the receptor binding site than morphine does. So it actually displaces morphine and other opioids, and it prevents full agonists from binding when it's present. This actually reduces relapse potential. Partial agonists are known as agonist-antagonists. We are preventing full agonists from binding to the receptor site. So in a way, partial agonists antagonize a portion of the response that a full agonist would be able to provoke.